The second principle of Catholic social teaching is acting for the common good. During the Austrian-Prussian War of 1866, Katharina Kasper sent sister nurses to work on the front in field hospitals, and again did the same during the Franco-German War of 1870-71. One of the sisters nursing on the front lines wrote, "Last night prisoners came, Frenchmen, Belgians, Russians, Italians, most of them very sick with grave diarrhea and full of pest," which refers to a virulent infection. She further writes, "We could practice love of our enemies, and I was happy from my heart that I could nurse and help these poor men." It did not matter which side the wounded were fighting on. The German poor handmaid sisters nursed all with the same attention and care. The posture of everyone matters or no one matters repeated itself when in America poor handmaids took on the ministry of the isolation hospital in Chicago, known as the Pest House. During the smallpox epidemic beginning in 1880, many healthcare personnel refused to assist smallpox patients because of the dreadful nature of the disease, because of its high contagion, and because of the low economic status of many of the patients. But for 68 years, poor handmaids continued ministering at Isolation Hospital, serving patients of all nationalities, ages, and economic status, who suffered from contagious or infectious diseases. The last known case of smallpox in the United States was 1949. In 1950, the isolation hospital was closed when other institutions had the capacity to provide isolation and medical care for patients with other contagious diseases. Poor handmade hospitals were mostly located in the inner city or in rural communities. In the last decade of the 20th century, these hospitals were floundering under the weight of explosive healthcare costs and delayed Medicare and Medicaid reimbursement. When a poor handmade hospital was reluctantly, but necessarily, sold to a healthcare system, the resulting monies were always invested in the local community, either in foundations or neighborhood centers or healthcare clinics. And this was to ensure that the needs of those living on the economic fringes in these areas still had access to physical and mental health care. These faith-based organizations, sponsored by the Poor Handmade American Province, continue to this day to advocate for the underserved, to develop and facilitate partnerships, and to address systemic community health disparities. This history is a remarkable example of acting for the common good, for those in need, whether they be friend or foe in wartime, whether it means putting oneself at risk in serving those with contagious diseases, or whether it means not deserting those on the fringes who are in need of health care, by designing an alternate plan for continued services for their physical and mental health care. The common good. Everyone matters or no one matters.